Welcome back to the stage, Dr. Amanda Meyers. She presented PEMF 101, and now she's going to talk about stacking modalities with red light.
All right, you guys, how's your day going so far? Everybody enjoying it? Learning some cool things? That's what's so amazing about this conference, right? A lot of biohacking. We love that. Make the body better, smarter, faster, not working harder to make it happen. We like that. Red light is one of those things. It's a great modality to stack with other entities that you're utilizing in your therapies with your clients and with their animals. So we're talking globally photobiomodulation. That's the real word for light treatment therapy. The history of it has been extensive. In the early 1900s, we actually gave somebody a Nobel Prize because we were treating disease already with it. It was fascinating. In the early 20s, we realized that our own cells actually do emit light, right? So again, just reinforcing this concept of we are light beings. In the late 60s and early 70s, we started using it in the medical arena for tissue healing processes, to decrease some inflammation, treating pain. So it's continued in its use within the medical arena fairly extensively. There are two major sources of light. We either have lasers, which are very focused, monochromatic, singular colored, coherent waves. These are beams that are narrow, pinpointed, and we use them in the surgical arena for cutting tools. We use them to treat some bacterial type infections. So they're very focused, very powerful. These are not home use devices across the board. The ones that we use are more LED in their base. They are on the opposite end of the spectrum. They are polychromatic. We have multiple kinds of light within one device. And they are non-coherent, which makes them a little less structured, which makes it easier to use and less dangerous to use. So it may be a broader application for that type of a tool. We look at light as a wavelength. We are counting a peak to a peak, or a trough to a trough, wherever you want to draw your line. We measure that in nanometers. 100 nanometers is 1 micron. For perspective, 400 microns is like a period at the end of a sentence. So we're talking incredibly small spectrums of movement. In the electromagnetic spectrum, we're talking about light. Light has a broad variety of things. We start at very long ends of it, which are then going to move into our visual spectrum, which then, as they get shorter and shorter, become more and more toxic to us. Those toxic rays are things like X-rays and microwaves. Those actually destroy cells. They're damaging. Literally, they break the bonds of atoms. And so we ionize things. We call that ionizing radiation. So we want to stay away from that sort of side of the scale for therapies. We like the end of the visible spectrum and into the infrared spectrum because that's where we get healing entities across the board. If we get further into the ultra-red zones, now we're just going to get heat as a byproduct. And sometimes we want heat as a byproduct when we're healing things. Sometimes that's a helpful stimulant for the immune system to draw to a space and then begin to help the body physically heal from whatever may be ailing it. The issue with almost every modality, like we stated earlier this morning, is depth penetration. How deep can we get? How much can we expose? How well does that get exposed? And we're really only looking at a couple of inches at best with a lot of the laser therapies and modalities that we have. Most of these lights are absorbed very rapidly. They're either bounced off, or they're scattered, or they're actually absorbed inside of another tissue, not penetrating down to where we want them to be. The longer the wavelength in this visible spectrum that we're utilizing is the more effective type of wavelength because it penetrates a little bit deeper for us. Some of this depth is, you can mitigate it with power, right? So like the product that we have, the new Rock, the red light that we have, it's got a higher power intensity to it. So we can get just a little bit deeper. We can treat it just a little bit faster because that power difference is present. The major block, realistically, in depth penetration is water. We're a mostly water-based being, 70 to 80%, depending on the literature that you read. The water absorbs aggressively light wavelengths. And so that's the key factor in not getting as deep as we would like it to because the subcutaneous tissues are full of a water product for us. So what is our optimum window for our treatments? We are looking at somewhere in the wavelength of 600 to 900. We want it to be something that we can absorb, that is non-ionizing, that is able to penetrate to the depth that we want it to go. 2, the major way that light is absorbed is through tiny little cells that actually love light. They're chromophobes, and these cells then create chemistry reactions that are physical in nature. We usually are moving electrons or the subparticles of electrons, right? The photons or the quarks, as we talk about them in physics. And all of this changes metabolism, increases second messengers. We're trying to enhance the cell structures themselves. We take information that's coming to the cell, we bring it inside, we take it to the nucleus. The nucleus then amplifies that information and shares that message with other cells that are near it. So we're looking at not just local effects, a lot of times we're looking at some big systemic effects that change. So what are we really doing? Well, we're doing a little bit like what we talked about this morning. We are targeting things that create energy in a system that then that energy in the form mostly of electron use that's being transferred is then increasing the ability of cells to do their jobs. So in the mitochondria, we're looking at cytochrome C oxidase as the major target. We're amplifying and increasing the amount of return rate on the electron transport chain, which is increasing our ATP. That sounds familiar, doesn't it? And we're looking at increasing second messengers, again, specifically the cAMP, which goes into DNA and RNA cycles, helps us proliferate cells, grow things back, recover, repair, heal. When we look at the cell structures themselves, we're looking at, again, those sodium, potassium pumps, calcium channels, the things that we're moving in order to keep cells healthy and increase our energy from that perspective, our voltage on our membranes across the board. The calcium pore is interesting. It actually increases our nitric oxide through another cascading system. Nitric oxide is incredibly important. It vasodilates things. It opens up our vessels, allows our flow of our blood to improve and increase. So again, we're going to bring better nutrition, bring better oxygenation, and then carry away the things that the cells don't require. That is our trash and the things that we need to get rid of. So we're decreasing our toxicity levels. We increase a growth factor secretion, which is really cool. And maybe the highlight of, for some people right now, is we're increasing collagen, which is where I think the beauty market is really targeting its use for red light therapies at this point in time. And then it also downregulates the inflammatory processes. So our cytokines they're very helpful. They're a monitoring system for us. If we have an injury or an issue that is sick, the cytokine comes, it communicates with other parts of the immune system to tell what to show up and what not to show up. But if we get over-aggressive, all of a sudden we are now in a storm cycle, as they say, and that can actually be very toxic to you. So we want it to be an appropriate conversation. So we want it to help us, but we don't want it to hurt us. So in engaging a better conversation and dampening sometimes that immune system that can be overly aggressive is pretty useful. So in the end, what do we find with red light therapies? We feel better, we're less tired, we feel stronger, we decrease inflammatory processes, we decrease pain cycles, especially in the nerve region where we're getting these neuropathies or neuralgias. We can certainly change that. We accelerate our wound healing, we improve our bone healing, we actually increase hair growth, which is also pretty cool, and then our skin surfaces can be improved as well. So red light therapy is a cool adjunct. It's, again, just one of those biohacking tools, strategies that we have that we can add into things like PEMF, because we're exponentially then improving what those devices can do for us. So anytime I can stack something, it's always a good thing for my client. And our new red light that we have, that we've just created, is actually shielded, so you can use it while you're using your PEMF device. There's no other device on the market like that. All of the rest of them, if you turn on a red light and you turn on a PEMF, you literally will destroy your red light and it won't work anymore. So we tried to fix that problem because we know time is valuable and we know also time is money. So a cool combination. All right, you guys, questions? I can't see anything. These lights are bright.
Bring, if it's on. Can you help? I think I just need to talk louder. Okay. So I was wondering what the limit is during each photo session of the absorptive capacity of the body. Photobiomodulation isn't like infinite, right? There's a limit. Because you had mentioned at some point that you were, for a tough situation, maybe looking at 3 times a day. Not in this session, but like something I heard last week.
So most of the time that is tolerated that you're going to gain ground with, is the better way to say it, you're looking at the power of device and the number of seconds that you're actually using that device. And that's, the power measurement is called a joule, right? So most of our devices are either 10,000 or 20,000 watts. And they're actually timed. You push the button, the 10,000 watt is going to last for a minute. The 20,000 device lasts for 30 seconds, and then it just shuts itself off. And that's the window of time that you would want to have over a single surface area. So utilizing it more than that, you're just not going to gain ground. We talked a little bit about that this morning with PEMF as well. There's a saturation point. So if you utilize it longer than that, you will detoxify, you will get stiff, you'll get sore, maybe a little bit nauseous, queasy, because that detoxification system that's happening will dump things, and then you feel like you've got the flu, is what we typically see. So you're looking at, again, power and time of use. If you have a lower powered device, that number of time that you're going to utilize it will rise, right? Does that answer your question? Okay. Anything else?
Actually, I'm going to follow up on that same question because I'm still confused because when I originally had gotten the LZR, I don't have the Rock, I have the LZR, if I remember correctly, they were just saying a maximum amount of time of 1 minute, not 1 minute per spot. And I'm hearing about some people using it for 20 minutes in an area, so I need to get some clarification on that if I can.
Sure, and if you're using it over a broad area, right, we talk about things like painting, where you're not just holding it over a single space, you're actually moving it around a general volume of space. And so it depends on how broad you're actually trying to treat. If it's a big square, it's a little square, right? So if you hold it directly over one site, then you'll want to stay in the time limits. And not that if you go over the time limit, you're going to have a large problem. We're talking detoxifications. We're not talking, I guess if you held it on top of the skin and you did it multiple times, you could end up with a heat-sensitive zone that most, if you're treating a human, they would be able to say, hey, that got hot. And if you held it too close for too long of a period of time, just like being out in the sun, you could get a little sunburn. So that would be the impact factor. Again, but probably the key is how long do you have to do it in order to get the maximum amount of result that you are looking for. And again, those lower powered devices, longer time in exposure, higher powered devices, shorter time of exposure to get where you want to be.
Luke, can you take that to her right there?
I'm building on that too. So if we're holding it on a certain area, it is just focused on penetrating that particular area, just 1/2 inch to 1 inch. So if we moved it over, another kind of like just lift it up and move it over, it's just working that area? Or is it similar to the MagnaWave coils where it's extending beyond the unit?
So what we know is that if we treat an area, that because we're amplifying signals and second messengers in cell structures, we're literally creating a network. It's like a phone tree, right? I call one person, that person calls a person, that other. And all of a sudden, you've got this Christmas tree of people being talked to about the same situation. So cells work like that, which is, in the medical arena, what we found interesting. When we treated a local region, we saw change across broad distribution of cell function structures. So I feel like, yes, you're going to maximize where you are maybe having the device over a layer of skin, but that then dissipates into a very broader, bigger picture for us.
Good afternoon. I'm treating a dog with canine lupus, and I have found that underneath the belly, I stack the modalities. I do the red light first, and then we lay on the mat, and then I also use the loop on the hindquarters she has hip dysplasia, and I usually use it around the front. But we have found that after it starts healing, the blackness on the stomach from the lupus and the scratching starts to dissipate and get lighter. It seems like it wants to come back, and now it's coming back again. Am I doing something wrong? Should I be doing something more with the red light, more with the MagnaWave, stacking them differently?
I think that things like that are more of a chronic issue than an acute issue. And a lot of our acute issues we can treat 2-3 times a week over 2 or 3 weeks, and that issue improves. But when we have something that is more autoimmune based, like lupus can be, you're looking at more of a retraining the nervous sort of construct, right? The nerve from the brain down into the spine out into the skin or muscle sections. We're looking at how does that DNA change over time? How does that cell structure recycle itself into something that's more functional? And in turn, you're going to see crops of things happen. You're going to get it under control, and then all of a sudden it's going to reflare, and then you're going to get it under control, and then it's going to reflare, right? I don't know that you're necessarily doing anything wrong. It just may need more management before you're going to see longer spaces of time before you have that resurgence occur. And it'll space itself out over time long enough that all of a sudden, now you're doing things to maintenance, the clean section of the physiology, instead of trying to repair the dysfunctional part of the physiology.
I see. I've been treating him since probably December, and it seemed like it was real bad, and then it got real nice and light, and then it would seem like it wanted to climb that ladder again, then it would go back down, and now, within the past week, she said he's itching real bad, and it's getting quite black, and I'm like, oh, I'm going to MagnaCon, so I'll figure something out.
How often are you doing it?
Pardon me?
How often are you doing the sessions?
Once a week, she's been having me come over.
Are you doing the same thing every time?
Yes.
That's your problem.
So I should switch it.
Yeah. Change the way you're applying the loops. If you saw a response, and you don't know what, like she said, you don't know what other triggers, like what else is going on that's causing this. Lupus is hard.
Yeah.
And I'm not a doctor, let's just preface that. But I would say if it were me, I would want to come at the cells a different way, with a different loop, a different time, possibly change the placement of the red light to other areas, just work on the body, because it can manifest one place but be actually something else could be causing it. So you want to look at the body as a whole and not just keep doing the same thing every day. You're not going to lose weight. You could start losing weight if you walk every day, but at some point you're going to keep gaining. Your body's going to be like, oh, we know what this is, we're just going to eat more, and so you got to switch it up. You got to lift weights, walk, run. You got to do different things in order to keep your body on its toes. And then obviously they're seeing a doctor, so I would make sure that what medications, what do they think is the trigger of the lupus? There's a lot that goes into something like that.
Yeah, they're thinking put him on steroids again because of the itching. I just got this message here today.
And that's fine. You can still do what you're doing.
Right.
And once a week might not be good enough. In my opinion, we're going into business, but business conversation, this may be someone who needs to rent a machine from you and do daily sessions. Like, you're not going to get ahead with one session a week. Somebody who has a chronic long-term illness like this they have to have, very much like Christian said, a lifestyle change. Instead of waiting for it to come back, there needs to be an overhaul in their wellness and their routine and how they're doing it. So that's somebody like that, I would rent them a machine, like something smaller, like even the Spiro, the Nova, the Aura Wave, something smaller, and say, hey, you need to do this every day or every 4 days a week, and then I'll come back once a month and I'll do the red light with you, and we'll discuss where you're at, and I'll be a good co-pilot with your medical professionals.
This content is not meant to present a diagnosis or healing protocols. It is presented as anecdotal information as PEMF is further researched and developed. Your questions, comments, and reviews are greatly appreciated. So until next time, this is Pat Zemer. Have a great day and wave on for better health.